I'm Liz O'Riordan, breast surgeon and breast cancer survivor and Empowered Health Ambassador. I'm thrilled to join this programme in their effort to empower people to take charge of their health, and I hope you'll join us too. Visit empoweredhealth.org for more information, and be sure to follow us on Instagram at WeAreEmpoweredHealth. When I was 40, I found a lump in my left breast, and I just thought it was a cyst. I'd had a cyst 9 months before and a normal ultrasound and a mammogram, but it was still there after a month, and my mum made me get it checked out. And I had another normal mammogram, and I asked the surgeon examining me what she thought it was, and she said, "I'm not sure." I had an ultrasound, and I turned to look at the screen, and I saw a cancer. In that split second, I knew I'd need chemotherapy, a mastectomy, what my risk of being alive in 10 years was, because it's my job to know these things. And I couldn't believe that I'd missed it. I'm a breast surgeon, and I didn't realise that my lump was a cancer. I had chemotherapy to shrink it first, followed by a mastectomy and radiotherapy. And 3 years later, I had a recurrence on my chest wall, which meant further surgery and further radiotherapy. I've had every single treatment I used to give my patients, and I realised I was not empowering my patients to cope with their diagnosis. I used to tell my patients, "Don't Google, let me tell you everything you need to know." And it's ridiculous because it's the first thing I did. And it was through reaching out to online platforms, to other patients on media, that empowered me. These women gave me the knowledge I needed to get through chemotherapy, what toothpaste to use, what to use when you feel sick. They told me what bras to buy post-operatively. And I knew none of this as a consultant surgeon. And that's where the patient community really empowered me. I thought I was a pretty good doctor before I was diagnosed with breast cancer. And I realized there were so many changes I could make to improve the care I gave my patients. And one of the first things I changed was the language that I used. As a surgeon and an oncologist, I've seen the worst of cancer. And when I saw someone with a small lump, I wanted to reassure them and tell them it was okay. And I'd say, "It's lucky we caught it early, and it's good that it hasn't spread." But when you're the one hearing you've got cancer, no one is lucky to get it, and no cancer is good to have. And it's only when you've been on the other side that you realise what an impact your words can have as a doctor. When I was a doctor, I thought it was my job to keep hold of all the information. And then when I became a patient myself, I was desperate to find out what was really going on. Hospitals now let people have access to their data, and it's transformed my care. It means I know exactly what's going on, because I'll meet different doctors throughout the whole of my patient life, and often they don't know the details, but I can tell them. Often mistakes will happen in notes. A left breast becomes a right breast cancer, and if the patient doesn't have access to their data, they might not be able to pick it up. If you said the words to me, cancer control, when I was a surgeon, it would have meant patients having the correct treatment, taking their tablets to stop the cancer coming back. But as a patient, I felt I didn't have control in the beginning. Everything was happening to me. I just had to go with the flow, and I hated it. And it was only by using apps on my phone to help record my symptoms, tracking what I was feeling and how I was going through each chemotherapy cycle as it went, being able to eat healthily and exercise and look after my body. It was only then I felt I had some control over what was happening to me. Let's talk about what quality of care means. As a doctor, I thought it meant doing the right thing at the right time, clinical effectiveness and safety. But there's a third factor that I've only just realized, and it's the patient experience. And if there's one thing that any healthcare professional can do to improve the patient experience, it's to tell them your name. A very good friend of mine with cancer, who's now died, was in hospital really, really ill. And doctors and nurses came in to break bad news and do tests and take blood pressure. The only person who said, "Hello, my name is Kevin," was the porter taking her to have a scan. By telling the patient your name, you redress the power balance. It makes us feel like we're your equals. It's easier for us to ask those questions we've been too scared to ask, and you'll get